Most people start supplementing calcium with a fairly relaxed attitude. As we age, we hear that bone weakening is inevitable. Postmenopausal women are often mentioned as being at risk of osteoporosis. Calcium is therefore seen as an integral part of long-term health care. Taking it early helps prevent bone loss, and taking it regularly helps maintain bone health. Few people ask further questions. Calcium supplementation usually starts very simply, 1 tablet a day. Some take it after meals, some in the evening, and some take it with vitamin D as usual. Initially, there's almost nothing special. You don't feel a significant improvement in health, but you don't feel any discomfort either. The body continues to function normally, you sleep as usual, and you work as before. This lack of adverse reaction creates a great sense of reassurance. Over time, taking calcium tablets becomes a habit, like taking any other supplement. Many people maintain this regimen for years without changing dosage, the form of the supplement, or reassessing their absorption rate. Some people start taking calcium supplements simply as a preventative measure, while others take them because of a slight decrease in bone density. Regardless of the initial reasons, the common point is that calcium is regularly introduced into the body while the physiological conditions of the body are improving. Physical changes are subtle and begin to appear with age. At this stage, very small changes start to emerge. Sleep is no longer as deep as before, and you wake up more easily. After sleeping, you don't feel refreshed, and you feel slightly tense inside even though you're not tired. These are some of the symptoms. Currently, these symptoms are not severe enough to be called a disease. They don't cause intense pain or affect daily life. Therefore, very few people associate them with ongoing calcium supplementation. When viewed individually, each symptom can explain itself. Poor sleep is due to constipation is due to intestinal issues, cramps are due to other nutrient deficiencies, and anxiety is due to worry. In the minds of most people, calcium is still considered safe and beneficial for bones, so it is rarely questioned. These seemingly separate symptoms actually often appear in the same phase. They are prolonged, not too severe, but persistent. Viewing each symptom separately obscures the overall picture, preventing the body from functioning as a whole. When multiple systems show mild symptoms, it is often a sign of an underlying disorder. Excess calcium is one such disorder. Excess calcium does not necessarily mean high blood calcium. The body has a very tight regulatory mechanism to maintain stable blood calcium levels, because calcium is directly related to the functioning of the heart, nerves, and muscles. Thanks to this mechanism, many people's blood calcium levels remain within the normal range, even when calcium in the body is not being distributed and utilized properly. Calcium in the body needs to be transported correctly. It must be absorbed from the intestine to the bloodstream, then from the bloodstream to the bones and teeth, where it is stored long-term. When this process runs smoothly, calcium performs its proper role. But when a link is broken, calcium can be retained, existing in an irritating form deposited in soft tissues. The term hypercalcemia refers to a condition of significantly high blood calcium levels. In reality, many people do not fall into this category according to laboratory tests, but still show signs of physiological excess calcium. In those cases, the problem is not the measured number in the blood, but the fact that calcium is not being delivered to the correct location. Women over 50 are more susceptible to this condition. At this stage, hormones change, the ability to secrete stomach acid gradually decreases, gallbladder function and fat absorption become less efficient, and mineral balance is also easily disrupted. When these changes occur simultaneously, prolonged calcium supplementation without proper regulation can easily lead to calcium retention in the body. The form of calcium use directly affects its effectiveness. Absorption. Calcium carbonate is a common form because it is readily available and inexpensive. However, it is difficult for many people to use, especially the elderly. Chemically, calcium carbonate has a structure similar to limestone and requires a strongly acidic environment in the stomach to dissolve. When stomach acidity is no longer strong enough, calcium carbonate is difficult to completely break down. the undissolved portion will not be absorbed effectively. In some cases, some calcium still enters the bloodstream, but not in the optimal way. In that case, calcium is not fully incorporated into bones, but tends to remain in free form or deposit in soft tissues. Using the wrong form of calcium in the context of impaired absorption and transport does not provide the desired benefit for bones. On the contrary, it facilitates the accumulation of calcium in the wrong places. Calciumus not deficient in quantity, butus not used correctly. It becomes a long-term underlying disorder affecting nerves, muscles, heart, and digestive systems simultaneously, even though test results may be normal. When excess calcium exists in the body in a form that is not properly regulated, the first symptoms often appear in the bones and sleep. Bone pain is a fairly typical sensation, not intense or acute, but rather a dull, aching pain that is difficult to pinpoint. Some people feel their bones are heavier and stiffer, especially at night or when the weather changes. This feeling is usually not accompanied by swelling or inflammation, so it is easily attributed to age or normal degeneration. Sleep is also affected very early on. Insomnia here doesn't mean being completely unable to sleep, but rather difficulty falling into deep sleep. The body is very tired, and there's a clear need for rest, but the mind refuses to shut down. Lying down, the brain still feels active, not thinking about specific things, but rather an inexplicable state of alertness. They may doze off, but the sleep is shallow and easily interrupted, and they don't feel refreshed afterward. The brain feels overstimulated and cannot transition to a state of true rest. Alongside these symptoms is the process of soft tissue calcification. When calcium is not properly incorporated into the bones, it tends to deposit in tissues not designed to hold calcium. In the kidneys, this deposition facilitates the formation of kidney stones. In the gallbladder, calcium is involved in the formation of gallstones. In blood vessels, calcium contributes to the formation of calcified plaques. Blood vessels become less elastic. In the eyes, long-term accumulation is associated with cataracts. In the joints, calcium deposits increase the inflammatory response, leading to persistent joint pain. Irritant synovial fluid causes inflammation of the synovial membrane, resulting in joint stiffness and pain during movement. In tendons, calcium deposits cause tendinitis, causing the tendons to lose their natural flexibility. Calcium also directly affects the muscular system through the mechanism of muscle contraction. Calcium is a trigger for smooth muscle contraction. When calcium predominates, smooth muscle tone increases in the intestines. This slows down intestinal peristalsis, causing constipation. Stools become drier, and bowel movements become more difficult even with minimal changes in diet. In the respiratory tract, calcium constricts the bronchi, creating a feeling of shortness of breath and mild chest tightness, easily mistaken for asthma or respiratory allergies. Another common symptom is frequent urination. People with excess calcium may urinate more frequently, especially at night. This symptom is sometimes mistaken for diabetes or urinary problems, especially when blood glucose tests show no clear abnormalities. This is often accompanied by nighttime cramps. When the body enters a state of rest, the feeder calves suddenly contract, causing pain and waking the body. Cramps often occur. Calcium buildup occurs during drowsiness or early morning, a time when the body should be most relaxed. In the nervous and cardiovascular systems, excess calcium creates a prolonged state of basal excitation. Anxiety appears without a clear cause. It's not worry about a specific problem, but rather a feeling of restlessness and mild tension. The heart is also directly affected. Calcium participates in the heart's contractile cycle, so when there is excess calcium, the heart rate becomes more sensitive. Patients easily feel irregular heartbeats, especially when lying still or at night. Transient extraneous beats may appear, causing a feeling of palpitations. Hypertension is also related to this mechanism. Calcium constricts blood vessels, and when vascular tone is prolonged, blood pressure tends taurus. In the treatment of hypertension, calcium channel blockers are very commonly used. The mechanism of this group of drugs is to reduce the effect of calcium on vascular smooth muscle cell sand heart cells. The need to block calcium to lower blood pressure reflects a reality. When there is excess calcium or the effects of calcium are too strong, the body enters a state of vasoconstriction and prolonged stimulation. All of these symptoms usually do not appear simultaneously and are not severe from the start. They develop sporadically. These symptoms are mild, prolonged, easily overlooked, or attributed to various causes. But when considered together, they reflect a common point. Calcium is present in the body in a way that causes stimulation, deposition, and contraction, rather than being used in its proper location and physiological function. In the body, calcium never acts alone. Every effect of calcium always requires an antagonist to control, balance, and terminate the activation process. The mineral that plays the most direct and important antagonistic role to calcium is magnesium. In terms of cellular physiology, calcium is responsible for triggering activities. When calcium enters a cell, muscles contract, nerve impulses are released, and heart cells begin their contraction cycle. But for that process to end, for the cell to return to a resting state, calcium must be withdrawn. Magnesium is the element that helps this process occur completely. Magnesium acts as an natural calcium channel blocker. It doesn't completely block calcium but regulates the flow of calcium into and out of the cell. When magnesium is sufficient, calcium is activated at the right time and withdrawn at the right time. When magnesium is deficient, calcium easily enters but is difficult to remove, causing cells to remain in an overstimulated state for an extended period. This antagonistic relationship is very evident in muscles. Calcium causes muscle contraction, while magnesium helps muscle relaxation. If there is only contraction without relaxation, the muscles will always be in a tense state. This explains why magnesium deficiency is often accompanied by muscle cramps and muscle pain, especially at night. It's not because the muscles are weak, but because they are not allowed to fully relax. In the nervous system, calcium increases nerve conduction. Magnesium helps stabilize nerve cell membranes. When magnesium is sufficient, the brain easily enters a calm state, making it easier to fall into deep sleep. When magnesium is deficient, the stimulating effect of calcium becomes dominant, making it difficult for the brain to shut down, leading to easier awakening, shallow sleep, and vague feelings of anxiety. In the cardiovascular system, this antagonistic role is even more pronounced. Calcium activates myocardial contraction and vasoconstriction. Magnesium helps the heart relax between beats, making blood vessels flexible. When magnesium is deficient, the constrictive effect of calcium predominates, making the heart more sensitive to stimulation in blood vessels, more prone to constriction. This is the basis for feelings of palpitations, mildly irregular heartbeat, and increased blood pressure. It is noteworthy that many people experience relative calcium excess not because they consume too much regularly, calcium, but because they lack a counteracting factor. Calcium is ingested while goat's milk is not adequately supplemented. Calcium is consumed regularly while goat's milk is not adequately supplemented, or absorption decreases with age. When the balance shifts towards calcium, the body enters a state of prolonged basal stimulation even though total calcium levels do not exceed its thresholds. Magnesium is not an antagonist to calcium in a negative sense. It is essential for calcium to function properly. Without magnesium, calcium becomes a mineral that causes prolonged tension, contraction, and stimulation. When magnesium is sufficient, calcium is controlled, used at the right time, and stopped at the right time. Therefore, when discussing symptoms related to excess calcium such as insomnia, anxiety, cramps, nervousness, or high blood pressure, it is necessary to re-examine the balance between calcium and magnesium. It's not just about whether there is enough calcium, but whether there is enough magnesium to keep the effects of calcium within safe physiological limits. One of the most important reasons for physiological excess calcium is not the amount of calcium consumed, but the deficiency of its soluble vitamins. These factors play a role in coordinating the pathway and destination of calcium in the body. Vitamin D is the first factor that is often mentioned. Vitamin D helps increase the absorption of calcium from the intestines into the bloodstream. When vitamin D is deficient, the body's ability to absorb calcium can be compromised. Reduced calcium absorption means bones don't receive enough calcium even with a healthy diet. However, the problem doesn't stop there. In many people, vitamin D isn't completely deficient, but simply insufficient to maintain long-term balance. This erratic calcium absorption causes the body to constantly adjust to maintain stable blood calcium levels. This prolonged adjustment increases the risk of calcium existing in free form or being unevenly distributed. Vitamin D doesn't determine where calcium goes after it enters the bloodstream. It only opens the door for calcium to enter the circulatory system. Without vitamin D and the necessary coordinating factors, calcium can accumulate in the blood and soft tissues instead of being incorporated into the bones. This is why some people, despite a regular vitamin D supplementation, still show signs of relatively excess calcium. Vitamin K2 is the key factor determining calcium's destination. K2 activates proteins that guide calcium into bones and teeth, while also preventing calcium deposition in blood vessels and soft tissues. When there is a vitamin K2 deficiency, even absorbed calcium does not have a clear destination. It easily deposits in inappropriate places such as blood vessel walls, joints, tendons, and kidneys. In this context, supplementing with calcium or vitamin D without K2 increases the risk of soft tissue calcification and calcium-related disorders. Vitamin K2 deficiency is particularly common in older adults and those who consume fewer traditional fermented foods. This is a silent deficiency, not causing acute symptoms but having long-term effects on how the body processes calcium. Calcium isn't deficient, but it's being misused. Vitamin F and essential fatty acids are often overlooked but crucial components. Fat-soluble vitamins, including vitamins D and K2, require a lipid environment for efficient absorption and transport. Essential fatty acids are involved in cell membrane structure, helping these vitamins enter cells and exert their effects. When vitamin F is deficient, the absorption and utilization of fat-soluble vitamins are significantly reduced. Even with a high vitamin intake, a lack of essential fatty acids makes cell membranes less flexible, affecting the activity of ion channels, including calcium channels. This increases the tendency for prolonged calcium excretion at the cellular level, contributing to a relative state of calcium excess. When all three of these factors are deficient or active inefficiently, calcium loses its natural control system. Calcium is still introduced into the body, but it is not absorbed consistently, properly guided, or maintained in a suitable physiological environment. As a result, calcium exists in an irritating and deposit-forming form, creating the basis for prolonged disorders even if blood tests may be completely normal. Fish oil does not directly supply calcium, but it plays a crucial role in regulating the effects of calcium in the body. The effect of fish oil is not to reduce the calcium levels, but to help prevent calcium from being predominantly irritating and to utilize it in a more stable way. The omega-3 fatty acids in fish oil are structural components of cell membranes. When cell membranes are sufficiently flexible, ion channels, including calcium channels, function more smoothly. Calcium enters and exits cells at the right time instead of being retained and causing prolonged irritation. Thanks to this mechanism, fish oil helps to mitigate the effects of calcium at the cellular level, especially on the heart, blood vessels, nerves, and smooth muscle. In cardiovascular medicine, fish oil is oftenest in cases of mild arrhythmias. Calcium is a factor that initiates cell contraction. In the heart, when this impact is too strong or prolonged, the heart rhythm becomes sensitive, easily leading to ectopic beats or palpitations. Omega-3s help stabilize heart cell membranes, reducing excessive excitability, thereby helping to regulate the heart rate, especially at rest. In hypertension, fish oil helps reduce the vascular tone, and calcium constricts blood vessels. When vasoconstriction is prolonged, blood pressure increases. Omega-3s help improve the elasticity of the vessel walls, reducing the spasmodic response, thereby indirectly supporting blood pressure reduction. This is why fish oil is often recommended as a supportive measurine controlling blood pressure and the respiratory system. The effect of fish oil is demonstrated through reducing bronchial spasms and calcium participates in the contraction of smooth muscle in the airways. When this effect is dominant, patients are prone to wheezing, chest tightness, and asthma like shortness of breath. Omega-3s have anti-inflammatory effects and soothe smooth muscle spasms, helping to stabilize the airways. For muscles, fish oil helps reduce cramps. Muscle cramps often occur when calcium triggers muscle contraction but isn't counterbalanced enough to relax the muscle. Omega-3s help improve the flexibility of muscle cell membranes, reducing this tendency to prolonged muscle spasms, especially at night when the body enters a state of rest, can occur. In the digestive system, fish oil can help improve constipation. Calcium increases the tone of intestinal smooth muscle, slowing down bowel movements. Omega-3 helps soothe smooth muscle contractions, supporting more rhythmic bowel movements, thus making bowel movements easier in some people. In arthritis, fish oil is used for its anti-inflammatory effects and immune response regulation. When calcium deposits or irritates tissues around the joints, the inflammatory response tends to be prolonged. Omega-3s help reduce the inflammatory environment, soothing pain and stiffness in the joints, especially in mild to moderate chronic inflammatory conditions. The common thread among all these effects is that fish oil does not treat symptoms in isolation but acts in the overall physiological framework, reducing prolonged irritation caused by calcium, stabilizing cell membranes, and helping organ systems return to a more balanced state. Therefore, fish oil is often used for many different, seemingly unrelated conditions, but in reality, they all share a common underlying cause: calcium dysregulation. Vitamin D is a very important factor in calcium metabolism, but this is also the most easily misused aspect. The misuse isn't because vitamin D itself is dangerous, but because its role is often misunderstood or incomplete. Vitamin D's function is very clear. It increases calcium absorption from the intestines into the bloodstream. When vitamin D is sufficient, the amount of calcium entering the circulatory system increases. This is beneficial if the body has the necessary mechanisms to process that calcium. But if it stops there, vitamin D doesn't determine where calcium goes next. A common mistake is using high doses of vitamin D for extended periods while lacking the necessary regulating factors. When vitamin D is supplemented in large quantities, calcium is absorbed strongly into the bloodstream. Tests may still be within acceptable limits because the body tries to regulate them. However, the increased calcium intake without a clear pathway makes it more likely to remain in free form or deposit in the wrong places. This becomes even more pronounced in the context of vitamin K2 deficiency. Vitamin D carries calcium into the bloodstream but doesn't play a role in transporting calcium into the bones. When potassium K is deficient, calcium is not transported to where it is needed and tends to accumulate in soft tissues. This accumulation does not occur suddenly but gradually and insidiously enough to cause long-lasting disorders. Calcium accumulates in blood vessels. Calcium makes the vessel walls less elastic. In soft tissues, calcium increases tone, causing spasms, inflammation, and tissue stiffness. At the cellular level, the prolonged presence of free calcium creates a state of excitation, affecting the heart, nerves, and smooth muscles. Therefore, continued vitamin D supplementation without a controlling factor does not improve health, but exacerbates imbalance. This explains why some people who regularly take vitamin D, even at high doses, experience the symptoms such as palpitations, insomnia, mild hypertension, cramps, or prolonged muscle tension, not due to vitamin D itself, but because vitamin D alone lacks a guiding system for calcium. Vitamin K2 is that factor. K2 is not vitamin K1. K1 is mainly involved in blood clotting. K2 has a completely different role directly related to calcium metabolism. K activates transport proteins that help move calcium from the blood into bones and teeth, while also preventing calcium deposition in blood vessels and soft tissues. When vitamin K2 levels are sufficient, calcium is cleared from inappropriate locations. In blood vessels, K2 helps reduce calcification, keeping vessel walls softer and more elastic. In soft tissues, K2 limits calcium accumulation. This prolonged effect reduces symptoms related to spasms and inflammation. Through this mechanism, vitamin K2 indirectly impacts blood pressure. When blood vessels are not stiffened due to calcification, vascular tone decreases and blood pressure tends to be more stable. In the respiratory system, reduced calcium accumulation in bronchial smooth muscle helps reduce the tendency for spasms, supporting the improvement of asthma symptoms or spasmodic shortness of breath. The most important aspect of vitamin K2 is its role in placing calcium in the right place. With K2 present, calcium is transported to the bones, where strength is needed. When K2 is deficient, calcium is diverted, causing stiffness in areas where softness is required. This difference that determines whether calcium becomes a beneficial mineral or a disruptive factor. Therefore, the issue is not whether or not to use vitamin D, but how it is used. Vitamin D only exerts its benefits when placed within a complete system, in which vitamin K2 plays a key role in controlling and directing calcium. When there is a deficiency of K2, vitamin D can inadvertently increase the risk of calcium accumulation in the wrong places, even if tests do not show obvious abnormalities. A very often overlooked factor in the story of excess calcium is the ability to absorb fat-soluble vitamins, which are central to calcium absorption. The key to this process lies in the bile and the gallbladder. Many people supplement with sufficient vitamin D, vitamin K2, and fish oil, but their bodies still don't improve. This isn't because the supplements are ineffective, but because they aren't being absorbed. Vitamin D, K2, and essential fatty acids are all fat-soluble vitamins. To enter the body, they need bile. Bile isn't just ordinary digestive fluid. Bile's job is to emulsify fats, facilitating the absorption of fat-soluble vitamins through the intestines. When bile is lacking, fats pass through the intestines but aren't processed properly. Vitamins are still ingested, but they only pass through the digestive system, not entering the cells. In older adults, bile deficiency is very common. The gallbladder functions less efficiently with age. Some people have had their gallbladder removed. Others shave a gallbladder, but bile secretion is insufficient or irregular. As a result, the ability to absorb fat-soluble vitamins is significantly reduced, even with a high intake of supplements. Common signs of bile deficiency are easily overlooked. Symptoms include bloating after meals, especially fatty meals, a persistent feeling of heaviness in the stomach, persistent constipation, pain or stiffness in the right shoulder or right back, and pale or film-like stools. These symptoms are often not related to vitamin absorption and therefore rarely receive the attention they deserve. When calcium is deficient, a chain of problems begins to develop. Vitamin D is not adequately absorbed, vitamin K2 does not enter the body in the right proportions, and essential fatty acids are not used effectively. As a result, calcium is introduced into the body through supplements or food, but the underlying regulatory system is not functioning. In that situation, calcium enters the bloodstream but is not directed to the bones. Vitamin D may still increase calcium absorption to some extent, but because of insufficient K2, calcium has no clear destination. It exists in an irritating form or deposits in soft tissues. The longer the supplementation, the more pronounced this becomes. This is why some people take sufficient calcium, vitamin D, and even K2 as indicated on the product label, yet still experience insomnia, nervousness. Calcium itself is not a problem simply because of its quantity. The problem lies in whether calcium is transported and used properly. When calcium is retained in the body, instead of going into the bones, it deposits in soft tissues. This begins to create a series of seemingly unrelated disorders. Symptoms such as insomnia, persistent fatigue, unexplained anxiety, mild palpitations, irregular heartbeat, nighttime cramps, constipation, and high blood pressure are common. Asthma or joint pain are not isolated problems. They are consequences of calcium being misplaced. Uncontrolled calcium increases muscle contraction and nerve conduction, stimulates heart cells, and causes calcification of soft tissues. Many people look at blood calcium levels and feel reassured because they see normal readings. However, excess calcium doesn't necessarily manifest as high blood calcium. Calcium can get trapped in tissues, blood vessels, kidneys, joints, and tendons. In such cases, tests don't reflect what's happening at the tissue and cellular level. The root of this condition is often not consuming too much calcium, but a lack of regulating factors. Vitamin D deficiency, vitamin K2 deficiency, essential fatty acid deficiency, magnesium deficiency, insufficient bile for the absorption of fat-soluble vitamins, pH imbalance, and prolonged stress all contribute to calcium deficiency. When these factors are lacking, calcium is no longer properly guided. It enters the body but has nowhere to go. Vitamin D only helps to... Calcium enters the bloodstream but it doesn't get into the bones. If there's a potassium K deficiency, calcium will accumulate. Magnesium emagis is an antagonist mineral that helps mitigate the effects of calcium. When magnesium is deficient, calcium is more likely to cause spasms and irritation. Fish oil and essential fatty acids help stabilize cell membranes, reducing the symptoms caused by calcium. When bile production is poor, all these factors are not properly absorbed, even with adequate supplementation. Therefore, the solution is not to continue treating each symptom individually, nor to mechanically supplement calcium. What is needed is to restore calcium to its proper physiological flow. When the regulatory factors are restored, calcium naturally leaves the soft tissues, reducing irritation, decreasing calcification, and returning to its structural role for bones. Then, sleep becomes deeper, the heart calms down, muscles spasm less, bowel function improves, and blood pressure stabilizes. This is not because the body is being forced, but because calcium is no longer the disruptive factor. And that's the core issue of excess calcium that so many people are experiencing but have never truly understood. Yeah, calcium itself is not the enemy. It is one of the most essential minerals in the human body. Without calcium, bones weaken, muscles cannot contract properly, and the heart cannot maintain its rhythm. The problem begins only when calcium loses its natural balance inside the body. When calcium is properly regulated, it becomes a structural mineral. It strengthens bones, stabilizes nerve signaling, and supports healthy muscle function. But when the regulatory system around calcium begins to fail, calcium slowly transforms from a supportive mineral into a source of constant low-grade stimulation. This is why many people experience symptoms that seem completely unrelated: poor sleep, unexplained anxiety, constipation, muscle cramps, mild hypertension, palpitations, joint stiffness, or fatigue. Each symptom appears small and manageable on its own, but together they reveal a deeper imbalance. The key point is that calcium metabolism is never controlled by calcium alone. It is guided by an entire network of nutrients and physiological systems. Magnesium regulates calcium's entry and exit from cells. Vitamin D allows calcium to enter the bloodstream. Vitamin K2 directs calcium into bones instead of soft tissues. Essential fatty acids stabilize cell membranes and reduce excessive stimulation. Bile from the gallbladder allows fat-soluble vitamins like D and K2 to be absorbed properly. When these elements work together, calcium moves smoothly through the body. It travels from the digestive system into the bloodstream, from the bloodstream into the bones, and stays where it is needed most. But when even one part of this system weakens, calcium begins to lose its direction. Instead of strengthening bones, it may remain in circulation longer than it should, or slowly accumulate in tissues where it does not belong. This is why simply increasing calcium intake is rarely the real solution. More calcium does not necessarily mean stronger bones. In many cases, restoring balance is far more important than increasing quantity. Supporting magnesium levels, ensuring adequate vitamin K2, maintaining healthy vitamin D status, consuming essential fatty acids, and protecting digestive function can often have a far greater impact on calcium metabolism than calcium supplementation alone. The human body is not a collection of isolated parts. It is a coordinated biological system where minerals, vitamins, organs, and hormones constantly interact with each other. When this coordination is restored, the body naturally redirects calcium back to where it belongs. Sleep becomes deeper because nerve cells are no longer overstimulated. Muscles relax more easily. The heart rhythm becomes steadier. Blood vessels regain flexibility. Digestive function improves. And bones finally receive the calcium that was intended for them all along. In other words, the solution is not to fight calcium, but to restore the system that controls it. Understanding this balance allows calcium to return to its proper role, not as a source of irritation or tension, but as one of the most important structural minerals supporting long-term health. If you found this explanation helpful, make sure to subscribe to the channel for more evidence-based insights about nutrition, supplements, and how the body really works. Because sometimes the biggest health problems are not caused by what we take, but by how the body processes it.